So like you had over in the East, that's all I was saying.
I was worried that if I put more in, we'd start just poaching CCPs from all over the world. So I didn't want to go too crazy.
This is brilliant. Thank you so much for your time, Kevin.
Thank you.
So I'm conscious we are running a little bit behind schedule, so I'm going to skip over the break. All the sessions are being recorded, and you have to give us till the new year to get them edited and uploaded. So I'm going to move on to Els Freshwater, Consultant Paramedic and Lead ACP for Emergency Medicine in a large teaching and major trauma centre. Currently seconded to Health Education England as the National Lead for Paramedic Education and Training. And another accolade for Els, which became the first paramedic to receive credential with the Royal College of Emergency Medicine. Els, welcome.
Thank you very much. I'm not brilliant at screen sharing though, so I'm going to try that in a second, and if you can just let me know if you can see it when it goes.
Just while Els does that, like I say, yeah, we'll be recording the videos, editing them. If you give us till the new year, we'll upload them to the CPD hub. But also feel free to drop us an email. I think I've got something coming up here, Els.
Have you got my slides?
No, I've got your notes.
Well, that's not good, is it?
Just share the other screen, that'll do. There we go. Perfect. I'll leave it with you.
Perfect. Sorry, I might be looking a little bit away from the camera. Thank you very much, Steve, and hi everybody. So my name's Els Freshwater. Steve, thanks for the kind introduction. And firstly, I wanted to thank Christian, Soma and Steve for putting together this absolutely extraordinary global event. So, and I appreciate that some of you have set your alarm clocks for a pretty horrible time in the morning, and for some of you it's way past your bedtime. So I'm really jealous, those of you in the Southern Hemisphere where it's nice and warm. And I was jealous of the Canadians and their snow until I heard about the frozen IV lines. So it's pretty wet and miserable here in England. And what I realise is what a small country we are as well compared to so many others. So what I'm going to talk to you about today is some of the advanced and innovative roles that have been carried out by paramedics here in the UK National Health Service. But just quickly to start with a little bit about me. So these rather unflattering photos are quite old now. I joined the ambulance service in 2002 as a trainee EMT and then qualified as a paramedic through the previous vocational route of training, in contrast to the BSc honours that's required for registrants into paramedicine nowadays. I spent 2007 to 2008 working with Queensland Ambulance Service, although I don't think I ever met Matt. I was in the southeast region as well, in a coastal town near to Brisbane. So I've got a little bit of international experience. You see, they didn't trust the crocodile with us and taped his mouth shut. So, on my return to the UK, I did a number of ambulance service jobs, including operational supervisor, emergency care practitioner, trained as part of the CBRN team prior to us having hazardous area response teams here in the UK, or SORT in Scotland, sorry. So I've got more than 10 years of air ambulance experience, including as clinical lead and education lead, where I developed the specialist paramedic program in my local service. And that's where I met Christian doing some work on critical care curricula. So also trained as an ACP, a bit more of that later, in emergency medicine, and was the first paramedic, as you said, credential with a medical law college. So nowadays I work as a consultant paramedic with 50% of my role being clinical and the remainder as the lead ACP and the regional program lead for the Emergency Care Advanced Practice program. And as you said, I also have a number of education roles and visiting lecturer roles. Sorry, my things keep moving on anyway. And I've been the Trust Major Trauma Education Lead. And then this year I completed a doctorate in clinical practice with my thesis focused on the triage of major trauma patients. And I'm seconded away to Health Education England, which is an arm's length body responsible for training and education of healthcare workers, where I'm the education and training lead for paramedics. And I have another role for urgent and emergency care in my regional advanced practice faculty. But anyway, that is absolutely quite enough about me, but I just wanted to give you a little bit of context to describe my interest in education and workforce development. So what is advanced practice? Well, advanced clinical practice is delivered by experienced registered health and care practitioners. It's a level of practice characterized by a high degree of autonomy and complex decision making. And this is underpinned by a master's level award or equivalent that encompasses the 4 pillars of clinical practice, leadership and management, education and research, with demonstration of core capabilities and area-specific clinical competence. And that fairly wordy definition comes from the document on the left, published in 2017. You can access that just via search engine. And this was pivotal in bringing together lots of strands and specialties of advanced practice, and also for helping to describe the level of practice rather than specific roles. So further to this, the Centre for Advancing Practice was developed and now coordinates our funding for training and also accredits higher education ACP programs. And there are other similar documents and frameworks in the devolved nations of Scotland, Wales, and Northern Ireland. And the College of Paramedics provides a postgraduate career framework from newly qualified paramedic up to consultant level. And as you can see from the diagram there, advanced practice fits within this. Oh, I'm sorry. So the Faculty of Prehospital Care provides an examination structure for 2 levels of exam, diploma and fellowship. And these are based on the IBT FEM subspecialty training curriculum, which is the training program that doctors who wish to become consultants in pre-hospital emergency medicine complete. And these examinations are also open to suitably qualified and experienced paramedics and nurses, and provide a framework for enhanced, advanced and consultant roles in this area. As this curriculum is focused on traditional pre-hospital emergency care, it's slightly outside of the scope of this talk, but if you are interested, you can find more details at ibtfem.org.uk. So, as I said, advanced practice is underpinned by academic education at master's level. And this includes not only clinically focused modules, but also those covering non-technical skills such as clinical decision making. And there's often an opportunity within this programme to undertake a substantial research or quality improvement project and to expand educational knowledge and experience alongside. So the 4 pillars of practice are increasingly being referred to now, even from undergraduate and newly qualified levels of practice. All advanced practitioners should be properly job planned, and a common job plan allows for 80% of time to be spent in clinical practice, with the remaining time, so usually about 1 day a week, allocated for other work, including service improvement, providing education and leadership activity. And then also, in addition, the 4 pillars are utilised within clinical time on the shop floor. So, for example, team leadership in a resource situation, teaching in situ, and working with colleagues to identify and implement quality improvement and evidence-based practice. But one of the things that's really helped, I think, to facilitate advanced practice in paramedicine, particularly within multi-professional teams, is the advent of independent prescribing. And this now means that we can prescribe a huge range of medicines in stat doses, as well as for administration or infusion, in line with doctors and other prescribers, such as nurse practitioners, for example. We do currently have restrictions around prescribing of controlled drugs, which includes, for example, opiate analgesia. But the College of Paramedics is working with those in government to update this. And we're also able to undertake additional courses of study that allow us to authorise the use of blood products, which of course is particularly important in the initial resuscitation stages of major trauma and for others with life-threatening hemorrhage. So advanced practice opens up lots of opportunities to undertake additional procedural competencies such as ultrasound, nerve blocks, cardioversion and pacing, which are not currently standard practice for UK paramedics. Additional diagnostic and monitoring procedures such as art-line access, lumbar punctures, joint aspiration. We insert chest drains, central venous lines, undertake procedural sedation, and some advanced practitioners will provide anaesthesia for a range of groups of patients, including neonates. And that's not independent paramedic practice in the UK pre-hospital environment. But it's not all about procedures. So advanced practice encompasses a wide range of assessment and diagnostic skills. So being able to interpret a variety of investigations like radiology, blood results, formulate differentials, implement complex management plans, or make safe referral or discharge decisions. So here's just some examples coming up. The RChem undertakes credential of nurses and paramedics and shortly pharmacists and physiotherapists as ACPs who are independent members of the emergency department workforce. And EM ACPs work across all areas of the department: minor injuries, trolley areas, resource rooms, short stay, observational units, respiratory assessment. And this program takes a minimum of 3 years to complete as an experienced paramedic on top of your previous practitioner experience. So trainees are allocated a consultant, which is an attending, I think, in America, as an educational supervisor, and undertake a large number of assessments in practice. And they complete an electronic portfolio of evidence, including reflections on practice, self-directed learning, multiple assessments, and can then credential in either adult or pediatrics, or with additional time in training across both curricula. And then the Faculty of Intensive Care Medicine endorses training programs to enable practitioners to be empowered to make high-level clinical decisions looking after critical care patients in ITU. And this is a minimum of a 2-year full-time program on top of existing ITU experience, and again, has the support of senior clinicians in practice. And again, in common with the RChem curriculum, trainees complete logbook of patients, reflections, patient and colleague feedback, and observation in practice. So although medical colleges recognise paramedics in advanced roles, our professional registration remains with the HCPC. And there are additional standards of proficiency around prescribing, but not specifically any additional registration of extended scope roles. But it is essential that we maintain proficiency within whatever our role is with relevant CPD, and then we declare this each time that we renew our registration. Oh, sorry. So I'd just like to share some examples of paramedics in these new roles. So there are a great many fantastic colleagues, some of whom will be on this call, working across the whole of the UK, who are in new and innovative roles, providing the highest level of care to patients, a lot of work that was previously only done by doctors. But these examples are just a few from the local organisation I work with, where we have paramedics working in major trauma, ITU, critical care outreach, cardiology and PCI time team. They sometimes receive STEMI transport via hovercraft from the Isle of Wight too, just saying. And trauma and orthopaedics and ED, and we have an advanced paramedic forum in the trust, and this has helped us to arrange placements across some various specialties as well, which has been brilliant. So this is Dolly. She's a specialist paramedic with the local air ambulance for 40% of her time, and then for the rest of the time, she's an RChem credentialed ACP in the emergency department. So in this role, no 2 shifts are the same, with patients being brought in or presenting with a huge range of conditions. And our ACPs work on the intermediate rota tier. And so they can often be running an area of the department or providing support to more junior staff on the shop floor. And Dolly has a special interest in research, done a brilliant project in our ED to improve care for frail and elderly patients who've suffered major trauma. And she also is co-lead on our ACP programme and does a lot to support trainees in the ED. So this is Louise. She's got many years of experience on HEMS too, and now does this for 20% of her time, and spends the rest of her time in the hospital as a major trauma advanced clinical practitioner. And so when she's on shift, she'll attend all the trauma calls in the ED as part of the multi-professional trauma team. And so she first meets the patient on their arrival and then continues to look after them until they're discharged home or into rehab. So she views patients on the ward, helps to manage their concerns, including prescribing analgesia and the associated laxatives for them. And her role also involves attending sort of multidisciplinary meetings to organise care, follow-up from therapy teams, referring to pain teams, psychological support, and so on. And it's this role has been evaluated and is very well received by patients. And then finally, This is Oliver, who has recently qualified as an ACCP and works on the neurointensive care unit. And our trust is a large tertiary hospital and is a specialist neuro unit for the whole region. And he cares for people with brain injury from trauma and medical causes, and has also completed his initial assessment of competence in anaesthesia, which is the same postgraduate program completed by ITU and ED doctors as part of their training. So he's the first paramedic ACCP in our hospital and has led the way in working with colleagues just to show how our skills and experience are suited to this role and other critical care roles. So what this means in our major trauma centre is that a patient can not only be looked after in the pre-hospital phase by a paramedic, but also that a paramedic ED ACP could be the trauma team leader. Then they'd be transferred to neuro ITU and cared for by a paramedic ACP. And when they're ready to step down to the trauma ward, they're then looked after by another paramedic in a major trauma role. So what's next? As I say, many colleagues in the UK are forging the way ahead in innovative and advanced roles. And the Consultant Practitioner framework has been released this year, which builds on the 4 pillars of practice and adds in consultancy, which is putting expertise in place across a systems level. And some people will also elect to reduce their clinical commitments and then undertake more work in other areas, for example, teaching on programs, and completing research. And the college are really supportive of non-traditional roles, and they have this hashtag, not all paramedics wear green. But I think realistically, as pressure across all healthcare settings increase, we're going to see more and more of these types of role and paramedics expanded into other areas of practice. So those are my contact details at the bottom. And does anybody have any questions?
Els, thank you ever so much for that amazing presentation. Where do you find time to relax?
Yeah, I'm trying to get better at that.
Just a couple of questions come around about education. Would you advocate studying an MSc prior to being in the appropriate role?
So I think it's really important to get the experience that you need while studying to be in a role that is supporting you and that is allowing you to practice those skills that you're learning and that you're getting the appropriate supervision and mentorship. For example, with the RChem credentialing, there is a benefit to perhaps undertaking part of the master's in another advanced role or in another practitioner role, because it is a huge workload to complete the master's and RChem credential at the same time. So, for example, if somebody was working in primary care and was able to get, 4 to 6 of the modules in advance, that would really go some way to helping them achieve credentialing. But it is important to be able to contextualize, I think, the learning from the master's program.
Brilliant. Listen, Els, thank you ever so much for your time on that. Again, an amazing presentation. Now you can go and enjoy your evening, what's left of it.
I think I'll pour a beer. Thanks so much.
Thanks ever so much, Els. So next up, I'd like to welcome Ed Griffiths. Holds a BSc in Mechanical Engineering, joined the Royal Air Force in 2003, serving 12 years as a search and rescue winchman in North Wales. Ed later became a paramedic in 2008, joining the UK Search and Rescue Helicopter Service, delivered on behalf